Welcome everyone to today's webinar, How to Build an AI-Powered Digital Front Door. On behalf of Becker's Healthcare, welcome and thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log in to today's webinar to access the recording. If at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box. At this time, it is my pleasure to introduce today's presenters. Dane Hoffman is the Solutions Lead at Notable. With over a decade of experience as a revenue cycle consultant, Dane's expertise lies in helping hospitals and health systems identify and implement process and operational improvement opportunities, increase standardization, monitor vendor relationships, and evaluate performance. With a focus on root cause identification and collaborative problem solving, he has delivered improvements across all aspects of revenue cycle operations, including financial clearance, patient access, care coverage, billing, payer follow-up, cash posting and credits, customer service, and pre-collection. At Notable, Dane focuses on the revenue cycle continuum, leveraging digital solutions and automation to improve patient outcomes, increase operational efficiency, and drive financial performance. Dane holds a degree in healthcare informatics and a Master of Business Administration. We also have with us today Gabriella Rosenblatt, Technical Delivery Lead at Notable. Gabriella's journey as a seasoned healthcare leader started with a background in hands-on patient care and throughout diverse settings. Witnessing the challenges faced by healthcare staff and providers, she embarked on earning an MBA in healthcare management and developed a passion for leveraging technology to enhance healthcare workflows and outcomes. Currently at Notable, Gabriella plays a pivotal role of overseeing Cerner intake solution implementations and teams. She has successfully deployed administrative and clinical intake automation across leading healthcare organizations across the country. Gabriella enjoys partnering with healthcare stakeholders to optimize how Notable automation will bring the most value to their organization, while also ensuring optimal patient and staff adoption to developed workflows. Dane and Gabriella, thank you for joining us today. I will now turn the floor over to you.
Thanks. Well, I'm going to drive for a little bit. We see the agenda here, what we're going to walk through, but let's just get right into it. The first thing we're going to do is actually define what the digital front door is, just to make sure we're all on the same page and level set there. So we have here all the touch points where providers and payers can digitally interact with patients or members to drive better access, engagement, and experiences across the service continuum. Very, very nice definition. You can see it on the screen there. I read through it. It's vague. That's what you kind of first reaction is, right? That's pretty vague. That's pretty broad. But that's by design, because there's so many different ways we can accomplish that goal and open up the digital front door. So level set, though, that's what we're thinking about. That's how we look at the digital front door, and that's what we'll be talking about today. The next thing we'll get into is sort of patient expectations. So what drives patient expectations, a little bit about the market, what we see in the market, and why patient expectations are where they are. So if we think about the market and what's going on, and really look at sort of everything that technology has opened up, there are so many different opportunities across all markets, not just healthcare, that technology has opened up. And arguably the biggest opportunity there is around consumerism. And here we can see there's so many different indicators of consumerism in all industries, but that obviously coming across into healthcare. And really consumerism is the norm. And that's the expectation for anyone in any industry. And it's the expectation that our patients now have. So when we think about patients and what they're going through and how that's kind of made its way into healthcare, it's really around patients wanting to use digital tools. And in consumerism here, it's in healthcare, it's here in healthcare, and it's here to stay. And this is really relevant to any kind of market that we talk about. So if you think about large large metro areas where there's maybe multiple health systems. Well, obviously, over the last few years, maybe you could extend that longer. But we know over the last few years, with the advancements in technology, that market has become even more competitive than it already was. And when we think about rural areas or small markets, even where maybe there's less of that health system to health system competition, there's new entrants in the market. There's new digital solutions, there's new care methods that make even small and rural markets much more competitive than they used to be. So whether it's a large market, large metro area, or a smaller market, we know that competition has become much greater, and largely driven by the concept of what technology can do and consumerism, that patients now expect their healthcare providers to provide that type of engagement and experience. As healthcare providers, as the industry, we've recognized this change. We've seen this going on over at least 20 years. We've seen more and more of this as technology has advanced, EHRs and now digital solutions. So we've invested. We've started to make really significant investments in some organizations into those digital strategies, building out teams, building out roles around digital strategies. But what we've seen across the industry is those digital strategies just haven't been as effective, and we haven't got the return that we would expect on that investment. So what have we seen? What's been going on and what drives that? And ultimately, we're not getting the desired outcomes that we would like to get. We're not seeing patient satisfaction that we would like to see. We're not seeing patient engagement at the level we would like to see. What we're really seeing is a lot of our digital tools are falling short, unfortunately. And they're falling short, leading to patients not engaging, leading to patients, which then leads to us obviously not having the engagement, being open to some of the consumerism and concerns that we've already talked about, and ultimately not having the best patient or staff experiences that we're investing in with these digital tools. So there's a number of different reasons that we might miss the mark on patient expectations, or patients might not engage. But the one primary or biggest driver of that is digital experiences ending up with some kind of manual touch or manual experience. Single biggest factor that drives patient engagement, drives down patient engagement. And there's a couple different examples I'll walk through. I think we've all probably experienced probably both of these, but definitely the first one, I'm sure. When we think about even a telephonic experience, so maybe we're on the phone, and maybe that's a digital IVR that we're dealing with, where I'm on the phone and I'm asked questions and I can speak the answers to the questions. Well, I go through this phone tree, I deal with this experience, and how many times have we then got to the end of the experience and then the phone rings and a staff member picks up? And then what do we have to do? We have to explain everything that we just went through on the digital IVR to the staff member to understand what my problem is, what I'm looking to solve, whatever the case is. That is obviously a really suboptimal patient experience, we could say. Worse yet is when it's a fully digital experience. So let's say now another example of this is I go to the website, I go to my health system's website. I want to schedule an appointment. I fill out all the information. I start, here's my provider, here's all the information, here's the ailments I'm looking to deal with or resolve. And then I get to the end of that and I'm given a phone number. Again, the same type of experience. What is that for the patient? That is, I'm doing all this legwork and ultimately I'm ending up in that manual experience. Patients are not going to engage in that environment. And it's what forces patients to look for sort of alternative methods or the traditional methods, because the digital environment that we're in isn't solving their problem. So why are we falling short there? What are the things that drive that? There's kind of two buckets that we put these into. One is point solutions and one is the native EHR solutions. So when we talk about point solutions, just again to level set, point solutions are, I've got a solution that solves one problem, or a vendor that's maybe solving one thing. So maybe I have a vendor to do appointment reminder text messages, then I have a vendor that I communicate with patients digitally, and then I have a vendor that does digital registration, something like that. Those would be three individual point solutions. As we can imagine, though, obviously that creates a very complex web of vendor management, of integration, and it's a lot to maintain. On the staff standpoint or from the staff standpoint or patient standpoint, oftentimes those tools aren't communicating very clearly or at all as well. So one interaction that I have with my health system provider might not actually end up in an environment that anyone else at the health system can pick up. So the interoperability is always a challenge with those point solutions as well. Then obviously, anytime that you're dealing with multiple different solutions, you have to go outside of the EHR. That can be challenging. There's always an issue of high total cost of ownership as well. So call out some bullets, but the ones I really think are the most important is the ability to integrate and the challenges that come from vendor management, integration, and maintenance of all those different solutions. Then when we kind of look at the bucket around EHR tools, we know EHRs are exceptionally good at being what they were designed to do, and that is be a system of record. They're phenomenal systems of record. They often lag in the areas we call system of engagement. Like they're not made, they weren't designed. They're secondary or tertiary aspects of the EHR that are there to engage with patients. So we're often not seeing the engagement, we're not seeing the results, the KPIs, the driving up of KPIs that we would expect with those EHR tools. A lot of times that comes from limited functionality or the complexity behind configuring those tools and what it requires from our IT resources in healthcare departments, or what it requires for even the EHR itself to build out, and kind of what the timeline is or what the roadmap looks like for that EHR. So ultimately, those are the two things that really drive digital front door solutions, or the two buckets that really drive digital front door solutions and really falling short, not being able to get where we need to go. And then why is that important? Why the emphasis on consumerism, talking about this and what all this means? It's because digital access is going to drive patient loyalty. We've seen that over and over again. And the importance there, it's even more important, I should say, over the last several years when that competitive landscape is increased and things have got much more competitive. And I think we'll round it out, and then I'll toss over to Gabby for a couple slides. But round out, I think one of our partners said it best, in that experience is the differentiator. And that's really the key. That's what's going to drive loyalty. Those patient experiences are so key. They're what's important, and they're what's going to drive results and drive engagement for patients. So Gabby, I think I'm going to let you drive for a little bit, and then pick back up in a minute.
Awesome. Thanks, Dane. All right, so let's talk a little bit about how these digital tools, when there is a lack of efficiency, how this can actually amount to more back-end work for staff. So when we work with many organizations, we often hear that they're all facing a mounting administrative burden. Some common themes that we see across the board are labor shortages. This could be anything from my staff is unable to keep up with the amount of work that they have on their plate, and we can't fill the positions that are currently set to be backfilled due to these labor shortages. Severe margin pressures from a financial perspective of having to determine where to make cuts and how to be most financially responsible when it comes to serving patients and staff. All of these pressures lead to compromised patient outcomes. We hear stories of patients that are unable to schedule appointments until months and months in advance due to a lack of slot utilization or the ability to simply get the patient in the door, to get their information into the charts. And missed care because of all of this is something that these digital tools all aim to solve for. And so we take a look here on our next slide, we'll see a little bit about how the use of these digital tools, while many of them have a theme or have a solution in mind that they're looking to solve, having 25 to 30 additional manual touches that is needed by a human to kind of be that point in between what the solution does and the patient's visit actually adds more burden on the staff. They are managing work queues in addition to the patient in front of them when they're trying to check in for their appointment. There is multiple points of quality assurance that has to happen in order to ensure that all of these systems are speaking to each other and that there isn't anything left that still needs to be done for the patient. A lot of paper that needs to be processed from a patient perspective, as maybe they're completing some elements of their workflows digitally. However, there is that one additional form that they need to complete, or there is an additional appointment that isn't utilizing that digital tool. So all of these create a cumbersome and very complex digital system for staff to navigate through, sometimes leading to more work than what we're trying to solve for. So Jane mentioned a little bit about these point solutions, and in addition to having multiple workflows, it's also different vendor management. You're having multiple implementations at one time. Staff are having to log into different dashboards and be accustomed to knowing what one tool does as opposed to the other. And this creates a lot of confusion, and change is hard. And so having staff needing to learn new workflows and how their workflow is changing at multiple points of their care continuum becomes quite complex. So here we have a great quote that pulls this all together from North Kansas City to showcase here. We've saved thousands and thousands of hours of productivity, and they've reallocated our staff time to more higher order functions within the healthcare system. This is something that we've heard as a goal of many of our organizations that they work with. Maybe the goal is to allow their staff to get to do some of the things that are most critical to those downstream or upstream operations from a healthcare perspective. So what are some signs and symptoms of what it looks like to have a broken digital front door? How can you know if this is something where those point solutions aren't coming together to save that efficiency? A couple pieces of the puzzle are your patients asking to validate the same information every time they come to the appointment? Are they having to fill out the same clinical forms every time they come in? Are they scheduling their appointments by phone instead of a digital interface? Do they report that they aren't happy with their digital tools, or they don't understand how to use them? And from a staff perspective, are the call volumes something that aren't attainable, that you're unable to get patients that are calling in and need appointments into scheduled slots, or getting their appointments to be scheduled with the needed information in order to see the patient? Are they manually reviewing work queues or reviewing data that's been sent over via fax or email or multiple different avenues? And then are they reporting an increasing level of burnout? Something that's very important to ensure that staff attrition is kept in line. So this all leads to the power of the digital front door utilizing AI, and why this is so important. So engaging your patients at every step of the way through an interface that is seamless. It's using the digital information where we can connect directly into the single source of truth, which is the EHR, is critical to allow all of our solutions to come together and to provide that seamless journey for the patient. So let's take a look at how that works. So utilizing AI allows us to personalize the digital front door experience for each patient and not need staff to build that experience. By utilizing different types of AI, we're able to pull out unstructured data and structured data from what is currently on file in the EHR to present that back to patients in a digital experience that they can engage with when the time is appropriate for them, and in a manner that is easy for them to understand and interact with. Examples of some of the data that we're able to pull out and surface in this experience: insurance card information, reading through what is currently on file, pulling out forms, PDFs, using computer vision to detect and classify what information needs to be shown to the patient based off of what the patient has already completed in their upcoming visits. Taking a look at structured data, such as discrete data fields thinking through registration conversations or forms that are currently on file, allowing your patients to engage with the experience and then taking their changes and their updates, and instead of putting them into a work queue, putting them directly back into the EHR to save the staff that step of having to manually update the EHR, as well as not knowing what information has been completed. So by creating that seamless exchange of information from the experience directly back into the EHR, staff know that when Notable has been completed, the patient has had the ability to see that information in front of them and complete what is required for their upcoming experience. Some of the power of automation is pertinent to some of the key indicators that you see here on this slide. So automating these workflows that your staff are currently performing and allowing it to be done at a higher speed and a greater sense of accuracy. Personalizing the experience, we're able to utilize logic that says, let's serve these specific clinical forms, or let's ask the patient these registration questions based off of their age, based off of elements of what we know about the patient's previous diagnoses, or whether they have a specific insurance type. This allows us to really interact with the patient for only their needs for their upcoming appointment as we engage with the organization. And utilizing comprehensive integration allows us to get to some of those hard to reach places. Utilizing different types of interfaces, whether that be APIs, HL7, RPA, allows us to not hit roadblocks with things such as discrete data fields where APIs may not be available, and allows us to really automate a lot of those repetitive administrative burden areas. And then lastly, utilizing a no-code experience allows organizations to play a key role in creating this automation and creating the experience for their patients. Having the ability to have those that are on the ground with patients every day and seeing these workflows and these pain points be a part of this AI experience and putting it together for their patients is something that creates a collaboration that really breeds efficiency. From a Notable perspective, when we think about what are some of the key solutions that make up this digital front door from a seamless experience perspective, we look across solutions that start with administrative and clinical intake, allowing patients to schedule their appointment, whether that's through an outreach to them saying, hey, you're due for upcoming care, or would you like to schedule an appointment, or bringing the interface to them through a website or a easy to access place where they can go through this experience, identify which providers they need to see for their care, and then schedule immediately. Automating the check-in process to speed up that interaction so that patients are submitting their insurance information ahead of time, paying their copayment ahead of time, and not needing to spend as much time upfront at the desk waiting in line and having staff have to manually scan in insurance cards or collect payments at point of care has been something that allows the patient to move from that scheduling phase directly into their registration, and then even move forward with any of those clinical forms that they would have to complete via paper in the waiting room or while waiting for a provider. Having this exchange done ahead of the visit not only allows the patient to feel prepared, but is also saving that time to allow patients to get in quickly and allow providers to focus on being patient-centric with their conversations instead of having to focus on documentation requirements or pieces of the visit that need to be collected from a chart perspective. So here, another quote from one of our partners, from a complex perspective. At a place like Gillette, we manage complex patient cases that often involve multiple provider visits, imaging procedures, and possibly coordinated therapy. The intelligent automation of scheduling to ensure the right provider is available at the right time is crucial to improving patient experience. By using these best practices, we've been able to basically eliminate the lines and eliminate the waiting in the room. So really powerful to be able to allow patients to be a part of that complex care, know what is coming next for them, and also save time when they're coming into some of these very important visits and spending a lot of time with their healthcare system, as there may be multiple visits in a day or in a week. So Dane, I'll hand it over to you.
Yeah, thanks, Gabby. I was going to say, I think the thing that's so crucial about the last comment there is just the emphasis. You know, I'll touch on this a little bit with some of our problems, but the emphasis on giving patients and staff time back, utilizing the tools to really improve efficiency or improve efficiency, I guess I should say, but really give that time back to staff so that they can focus on what's important. We'll talk about that in a little bit, but I think that's so key, and really goes back to the consumerism piece and what patients are looking for. I don't want to spend time in line when I don't do that in any other industry or any other thing. If I can avoid that, that's what patients are looking to do. And it's even maybe more relevant, like in an example like Gillette, where there's so many complex cases that patients might have multiple appointments and multiple different situations going on. So I think that's a really good one, and something that really ties back to the aspect of consumerism and why things are so competitive and so patient focused now. I should say. So we went through sort of kind of teed up, here's sort of the problem, here's multiple ways we can solve that problem, or multiple solutions for it. But then what are the best practices for actually implementing these things and building them out? So that's what we'll spend a little bit of time on now. And there's really three key items. So we'll top line them on this slide, and then we'll kind of do a deep dive or a minor dive into all of these moving forward. But the first one is just evaluating solutions as a checklist or for a checklist. It's kind of pitfall number one. You really don't want to just go down the checklist and does it have this, does it have that, etc. What you really want to look at is, what is the core problem we're trying to solve? And then once we have that core problem, then we can get at the solution and the KPIs and what drives that. But ultimately, what is the core problem we're trying to solve? That's where we need to focus, kind of like issue one. Pitfall two that we see is overlooking the impact on staff workflows. And Gabby mentioned this a lot, spent a lot of time on that. I kind of highlighted that earlier on as well, but it's really looking at how does this affect the staff, and then invest in that staff engagement as well. So that's kind of best practice way to avoid that pitfall number two. And then the third one we see is delaying deployments or really long deployment windows. We find the best way to do this is to iterate and scale the deployments, and we'll spend a fair amount of time on that and how that operates. But really, it's avoiding those really long deployment and planning windows in trying to learn, iterate, and improve. So we'll kind of deep dive into the first one now, doing the feature function tech checklist, if you will, and how to avoid that. And we really want to get at, solving that core problem. And when we solve that core problem, it really means we're going to get to what the end state is. So in the perfect world, in utilizing this tool in AI or whatever vendor, whatever we're trying to build out, what do we want our patients to do? What do we want our staff to do in that end state? And then that is, how do we solve the problems that prevent us to get to those end state? How can we use the tools that we have at our fingertips to solve those problems, get to where we need to go? And then the next step of that is, now that we've identified the end state, we also know what are the right KPIs that we need to look at to evaluate our performance against that goal or against that end state. And that, so often when we think about organizations that kind of fall into that pitfall, if you will, where it's feature checklist, they're not thinking about the end state, and they're not thinking about how can we actually evaluate, and what are we actually going to drive with this tool. So there's two steps there that they're kind of totally missing. And that's where it really comes. Let's focus on what's the problem we want to solve, what is the end state we get to, and then what results do we anticipate driving there. So that's number one. The second one we get into then is around staffing. In the way that I think about this is, no initiative is going to succeed without staff engagement. And a great example of a scenario or something that might come up about this. Let's say that we bring in a vendor that's really great for patient registration. We think they do a great job. We bring that vendor in, but we don't think about the staff impact. And it turns out that actually after the patient does all the work, the staff gets an email or a PDF that they then have to key that information into the EHR. So we might have something that's really patient-centric and great, but it's actually creating more work, as Gabby alluded to. These situations come up where we're actually creating more work for the staff and creating a situation where the staff now has got more work, and it's more work that frankly they don't want to do. And that's what's the key here is we have to get staff engagement. And the way that you do that is by putting staff in the situation that they really want to be in, that the reason that they got into healthcare. And we have the quote here from Karen that actually highlights this. She says it probably better than I do, but I'll kind of paraphrase some of the things. It's really about fulfilling staff potential. So many of these staff members, even administrative staff that work in healthcare, they're choosing to work in healthcare because they want to help people. They want to be part of that care delivery team. They want to be, show compassion, help people out in a difficult time in many cases. Well, when they're keying information into the EHR or reading emails just on the phone, doing a bunch of laborious, sort of repetitive tasks, that's not getting to their potential. That's not why they wanted to get in healthcare. So I think that's really a key here. It's think about the impact on staff as well, and how can we elevate what our staff is doing so that they're doing the tasks that really require that human intervention, and they're able to really spend their time on tasks helping patients, being compassionate, providing that personalized care to patients, which is really why they wanted to get into healthcare in the first place. And then the third thing, or actually, I take that back. Gabby, I think we have a couple examples for you to actually run through some staff examples here. So actually, I think I'm going to kick to Gabby for a couple slides. Yeah, here we go. Perfect. Gabby, I'll let you take these ones.
Perfect. Thanks, Dane. So everything, Dane, you just said was spot on. I think we see that we can have a great patient experience. Patients can be engaging for 80% of patients coming in for a staff day, but if the staff doesn't know that the patient has completed it, we're now causing a duplicative experience for the patient, as all of that information that they gave has to be collected all over again. And so what we've seen is having that change management process and creating a workflow for staff that is not necessarily completely changed, but one that is teaching them exactly how this is going to create a better experience for them as well as their patient, where exactly to look in the chart to know what is that key indicator that this is going to be a abbreviated check-in process, or that payment is already collected, has not only helped the staff to recognize their own time savings, but also helps them to talk that through with the patient to say, I see you've paid your copay. I see that you've submitted your insurance information. Thank you for validating that information. Therefore, driving the patient to want to complete this for each of their visit, and for them to understand, why do I have to do this at every visit? This information is critical, and we as patients don't realize that whether we get asked all of the questions at every visit or not, all of that information does need to be kept up to date from visit to visit. And so having the staff be the advocates for patients engaging in these digital tools and showing them why it's so important is key to ensure that these digital tools are efficient and successful. So here's an example of configuration that we've seen work with some of our partners to alert the staff, and they know in one singular place, if they need to look to see what's been completed by Notable, or if the patient completed Notable, they can come to one single place in the EHR. It's already within the registration components of their conversation that they are working through as they're checking in their patient, and a great way for them to just kind of eyeball what's been completed and what still needs to be done. This ensures that we're not causing the staff to feel as if everything has been completed and there's no check for the patient, if that's not the case from a workflow perspective. But it drives them to ask that one question of, this is a notable experience. Is there anything else that I need to complete for the patient, in one easy to reach place? They don't need to log into a separate dashboard or a separate queue that's outside of their current workflow, which we found has been critical to adoption when it comes to staff and change management. So Dan, thanks for letting me share that tidbit. I'll pass back over to you.
Yeah, I was a little too excited to get to iterating and scaling, and I just jumped right in. So the next one is sort of the third pitfall. In kidding aside, that there's a lot of excitement around this, because I think there's so much opportunity for this. Some of this, coming from my previous life in consulting, I've been part of some of those really long deployment in the planning and everything that goes on, and I imagine almost all of us on the call have been involved in some type of technology integration, whether it be as big as an EHR implementation or a smaller solution, where we do months of planning, maybe weeks on a smaller one, but oftentimes months of planning goes into, this is how we implement, this is every workflow. We're going to go through every workflow that's ever existed and see how it's going to operate within this new technology. And what we often find in all that planning is there's go live months down the road. We have the go live, and I don't know, 20 to 75% of that planning goes right out the window within like a week of go live, because there's different complexities, there's different challenges, there's different IT resources and requirements, and you just can't ever plan for everything. And what ends up happening is you lose all that time that you were spent planning, that you could have been driving results and improving, was spent all this planning, and then a bunch of the planning gets thrown out anyway. So that's why I think this is such a big one as well. Leveraging agile deployment or agile implementation is so important. It is really a key thing in so many ways, because one, it means we can drive results quickly. If we're able to implement at with the showcase sites or a smaller cohort, we can learn from that, we can drive results there, and then we can scale those results out. The other thing to think about is, obviously, we're limiting the IT resources or the IT lift that's required. We're also limiting the operational disruption. We're not saying we're going to upend, half of the organization or the whole organization. We're going to, again, focus on certain showcase sites that are a good representation of the full organization. We're going to learn from them, and then we're going to iterate and expand and go to scale. And I always come back to the most important piece here is the learning piece. And Gabby knows this better than I do. But the what we're able to learn in those early phases of deployment is so crucial to us being able to then improve our current solution, and then improve for the ensuing deployments. And that's where we can drive that value quickly. We're not spending a lot of time planning that then oftentimes that planning time isn't well spent, because it doesn't all manifest anyway. And we're able to learn. We're able to learn and develop and improve. So I think that's what's really important, and why this may be the most important kind of pitfall to avoid, in my opinion, with some of our experiences and the success we've been able to drive at Notable. All right, Gabby, I'm going to turn it over to you for the case study.
Perfect. All right, let's tie this all together. Let's see how utilizing these strategies that we've been talking about can lead to efficiency within a healthcare organization. So the case study that we have here is looking at North Kansas City Hospital, which provides the largest network of provider practices in the Northland region of Kansas City, Missouri. So taking a look at some of their outcomes, if we look at the next slide, we see some of their main goals are ones that echo across several organizations from healthcare perspective: improve the patient experience, reduce staff burnout, improve financial performance, and improve care quality. And so from a a quote perspective here, we see how some of these outcomes have been critical to not just the patients, but to the staff as well as their operational leaders. So having that full circle of agreement that having this digital efficiency is one that is providing better care and outcomes for patients and staff alike has been really pivotal for us to be able to paint the picture of what do our best practices look like when we are deploying these strategies at an enterprise level with our healthcare organizations. Taking a look at some of the outcomes here. So we see Dane talked a little bit about that iterative approach to how we deploy. And looking at from February 2020 into May to 2020, well, this timeline kind of depicts how much is able to get done in just such a short amount of time. Even though it may seem like that showcase site is only a portion of providers and practices that you're going live with in the beginning, having those first couple weeks to really get things right, to answer all of the questions and see how can we be prepared as we bring this live across the organization is something that's pivotal to allow us to go fast, but also scale responsibly as we know that what we are implementing, we've seen it work. We've seen in that healthcare organization that what is recommended is something that is being adopted by patients and staff, and we know how to answer those questions and ensure change management is correct. So from this timeline here, we're able to see how from kickoff we were able to very quickly move into live COVID vaccine scheduling, which was a wonderful partnership and collaborative journey to be able to bring vaccine scheduling live for patients in the time of COVID, to be able to partner together and create something so meaningful and so quickly is something that speaks to utilizing a lot of these best practices when deploying and bringing this live for patients. After their vaccine scheduling, quickly moving into registration and intake as we recognized the uptake of the solutions with patients of the organization. And from there have continued to scale into several different solutions across the org. The beauty of the partnerships is we're continuously finding creative ways in which engaging patients through the same digital seamless experience can continue to provide efficiency outside some of the core components that are first brought live. So some of the outcomes that we've seen here: 90% reduction in check-in time when patients complete Notable, saving time for staff as well as patients. 80 open roles that were unfulfilled have been able to be addressed. 34% decrease in no-shows through our confirm cancel capabilities of allowing patients to quickly cancel their appointment and be informed of their upcoming appointments all in one through those appointment reminder outreaches. 80% of patients pre-registered via Notable. And so this is really important to be able to get all of that registration, demographic information continuously up to date for the patient, as well as their insurance and payment information. And then seeing here that 70% of staff are all for having this digital experience for their patients. That's something that we take pride in, knowing that staff really rely on Notable. Hearing that staff need this in order to complete their day-to-day efficiency is something that allows us to know that our best practices are working well, and where we need to iterate and continue to try to be better. All right, so we'll now hand it back over to Beckers to see if there's any questions or anything Dane and I can dive deeper into.
Wonderful. Gabby and Dane, thank you so much for sharing with us how to leverage AI to power a digital front door that patients love while decreasing work for staff. And thank you to our audience for your thoughtful questions so far. Please continue to submit your questions through the Q&A box on your console. If we're not able to answer your question on the line today, we will follow up with you after the webinar. Let's dive right into our first question here. This audience member is asking, does Notable integrate with the EHR? We have Cerner and have had issues with past vendors around issues with integration, which leads to manual work for our staff.
I'll go ahead and take a stab at this one first, Dane. So yes, Notable integrates directly into the EHR. We are a Cerner code validated program partner, which allows us to seamlessly utilize APIs where we can to integrate and get data in and out of the chart. We also utilize RPA and other AI mechanisms for some of those areas where we want to ensure we can automate, but APIs may not be available at this time.
Great. Thank you so much, Gabby. Next question here. This audience member is asking, what are the early indicators that our digital front door strategy is effective?
I can take a stab here. I would say there's a couple leading indicators. So those would be the early indicators, obviously, but I would say patient engagement, whatever patient engagement rates you can get or utilize, number of scheduled appointments or the percentage of scheduled appointments, is that improving? Are we getting more higher percentage of appointments scheduled online through our digital front door? And then digital registrations would be the same kind of thing. Are we improving or increasing that percentage of digital registrations? I think I'll also do a couple sort of lagging indicators, but staff and patient engagement, well, I guess staff engagement can also be a leading indicator, but staff and patient satisfaction as well, I would say are lagging indicators that are key, that maybe aren't really early on, but you can start to see those. So pretty early in the process. So that's kind of my thoughts, Gabby. And anything else you would add there?
I think you hit on all the key ones.
I'll take it.
Awesome. Thanks for walking us through that, Dane. We have time for one more question here, and this question's around staff buy-in. We have rolled out previous technologies that haven't delivered the results we want, and our teams are burned out. What would you recommend to drive staff buy-in?
Getting staff involved, having super users or engaging them in surveys of what is most important to them. Where are they most excited for this automation? Getting them to understand the why, or the what's in it for me, as it relates to why is engaging this digital tool going to be something that's important. It's not necessarily here to do everything that they are doing, but explaining to them what the outcomes are going to be for them and how it's going to allow them to be more patient-centric and get back to focusing on the patient as the center of that upcoming appointment, is really critical. Recognizing, what their questions are, having a mechanism for how they submit feedback and get support so that they can continuously learn and have their questions answered, and therefore teach each other as they have new team members that come on that will be adopters as well of the technology and digital solutions. Dane, anything you'd like to add there?
I might add one other thing too, that I think it seems very small and could almost seem trivial, but make sure the staff actually go through the patient experience as well. I think that's something. So whether they are patients or whether it's a demo environment, they can see it, but so that helps in a couple ways. One, they see the benefits on the patient side, but two, it also helps them from if I get questions, someone comes into me and they're asking me a question. Now I've seen it, I've been through it, I know it, and I'm more prepared or better prepared to answer that patient question. So I think also just making sure, Gabby hit on that a lot with like hands-on. So it's probably sort of included in what Gabby said, but I think that just specifically is another good way for them to actually go through the experience. I think that helps a lot too.
That's a great call out, Dane.
Great. Thank you both for that answer. That is all the time we have for today. I want to thank Dane and Gabriella again for sharing their time and insights. And I also want to thank Notable for sponsoring today's content. And to our audience, thank you so much for joining us. Please take a moment to fill out the post-webinar survey on your console and have a wonderful rest of your day.